going
Dude,
quickly.
this is so
At
cooked.
worst, this
We
goes
are
up.
at the
Thank you very much,
mercy
Bobby,
of
for-
madmen. We are at the mercy
President
of the
Trump's
most
urging
insane
NIH,
people,
FDA.
dude. All right, now we're getting to the real fascism.
And it's not that everything's
Here it is.
100%
The moment you
understood or
waited
known,
for.
but I think we've made a lot of strides. Wish it was done a long time ago. Today, we're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz, and Acting Assistant Secretary of HHS, Dr. Dorothy Fink. So thank you all. Thank you, Dorothy, very much. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, you know, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys. 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000, and then you go to 12, you know there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism.
That's not true. If you're less likely to take a vaccine, you are infinitely less likely to go get diagnosed by a medical specialist to see whether you have autism or not. That's it. That's the only reason. Oh my God.
Yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say.
Great. Yeah, you're only the president.
As an example.
It's good that you're careless with your
essentially
words.
No autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen.
Oh, God.
Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's For instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you can't tough it out, or if there's a problem, you're going to end up doing it.
Why
the
are
other
they?
thing that I can tell
I don't
you
even
that
know.
I'll say
I
that
don't even understand what the purpose of this is. This just like
later date.
this is just a way to people over. That's it.
Over a 5-time
It's just
period.
pure bad. I can't even see any like profit
times,
upsides for any company in this process. You know what I mean?
smaller
Only
doses,
downsides.
And you
It's
spread
just
it out over a period.
let's f it up. Let's f it
they
up
pump so much
aggressively.
stuff into
Who
those
gives the
for little babies? It's a disgrace. I don't see it. I think it's very bad. They're pumping. It looks like they're pumping into a horse. You have a little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And it's artificially induced. It's not like something that when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it. And that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel.
What I feel. My feelings.
Measles. And the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate, because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact. So let those be taken separately. And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about. I mean, this was mostly going to be on how not to have the child affected, but we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can get better. And in some cases, maybe substantially better. Not going to be easy, but be a lot easier if it didn't happen in the first place, as these great parents fully understand, right? They fully understand. I feel so terribly for. I have so many friends with autistic children. It's a tough situation. Finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. Can you have mad lawsuits
for him using the Tylenol brand
there's a
mainly
rumor,
for this?
and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one.
What? They have paracetamol, dude. They have a paracetamol substitute. What the
autism. That tells you a lot. And I want to say it right now. And you know the way I look at it? Don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on this subject for a long time. You know, life is common sense, too.
It can only good happen.
There's a lot of common sense
But my autism is the
this,
problem.
I wish things like this were brought up, and this group has worked so hard on it. But I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quickly.
Dude, this is so cooked. We are at the mercy of madmen. We are at the mercy of madmen. Once again, the dumbest, most hysterical losers in American society are getting their wishes be heard and turning it into government mandate. We are at the mercy of the most insane people, dude, whether it be evangelical Christians when it comes to abortion and numerous other hysterics that this administration listens to, or whether it be all of the anti-vax cranks and their consistent advocacy that has led to RFK Jr. becoming a permanent fixture of the administration. That's what this is. They're literally giving red meat to like key constituencies of their base, and they all happen to be schizophrenic hallucinators.
Genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism.
What do I say, man? What do you say to this? What do you say to this? What do you say to this? It's so cooked.
We have also evaluated the contrary.
This is so dumb. I don't know. I don't even know what to say. We're literally, his brainworm is running the health initiatives in this government.
Pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health. FDA also recognized that acetaminophen is often the only tool for fevers and pain in pregnancy, as other alternatives have well-documented adverse effects. HHS wants, therefore, to encourage clinicians to exercise their best judgment in the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required.
Oh, so they can have a little bit of autism, I guess? Is that what it is?
Of science. The safety of acetaminophen against the risk of neurodevelopmental disorders in young children has never been validated. Prudent medicine, therefore, suggests caution in acetaminophen use by young children, especially since strong evidence also has associated it with liver toxicity. Some studies have also found the use of acetaminophen in children can potentially prolong viral illnesses. FDA will drive new research to safeguard mothers, children, and families. In addition to a possible acetaminophen connection to autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism. We have also identified an exciting therapy that may benefit large numbers of children who suffer from autism. Peer-reviewed literature has documented that up to 60% of folate-deficient children with ASD can have improved verbal communications if given leucovorin. I have instructed NIH, FDA, and CMS to help doctors treat children appropriately. Jay will help tell that story, which started with sound science, the kind that restores faith in government. This announcement also represents a historic collaboration between NIH, FDA, CDC, and CMS. We expect this to be the first of many announcements over the coming years that deliver actionable information to parents on underlying causes of autism
beacon
and the
of
potential
health,
paths
baby.
for prevention and reversal. Finally, autism is a complex disorder with multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines.
You want to know the worst part of this? People are talking about his hand, right? Souls never actually take the anti-science, anti-medicine rhetoric to heart. When doctors come to them and say, this is what you got to do, they don't go, no, actually, I'm going to inject. That's the worst part about this, because they don't even practice what they preach, bro.
These mothers for 3 decades.
RFK does? Yeah, well, he's on the verge of collapse. Exactly.
Actively suppressed in the past. It will take time for an honest look at this topic by scientists. But I want to reassure the people in the autism community that we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we
Out of these through this piece of, by the way, is a real doctor. So for him to also play this song and dance is, of course, expected, considering if you know his background, you know that he was already prosecuted for selling snake oil. Okay, but he's a real doctor. He knows exactly what these kinds of idiotic decisions are going to lead to. But he doesn't give a because I'm sure he has a stake or something in whatever they're presenting as the cure to autism.
Thank you, Secretary Kennedy, and thank you, President Trump.
Thank you very much.
I'm proud to announce today that the NIH has launched the Autism Data Science Initiative to turbocharge autism research, devoting an additional $50 million to the cause of studying autism. Nearly 250 research teams from across the country applied, sent in their applications, and were peer-reviewed by the NIH review panels. The NIH peer reviewers chose the 13 best projects focused on root causes and therapies, with replication and validation studies to guarantee gold standard science. The studies feature a new kind of science called exposomics, where scientists consider environmental and medical factors, nutrition, events during pregnancy, in combination with biology and genetics to answer vital questions about autism. Science like this, conducted in partnership with families and physicians, is the best way to arrest and reverse the autism epidemic. Autism spectrum disorder encompasses a very wide range of symptoms, ranging from mild difficulties with social interactions to profoundly autistic children who experience severe disabilities in speech and behavior. Given this wide range of symptoms across the spectrum, it seems certain that there will be a wide range of biological contributors to explaining the cause. The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem.
They're gonna
The sharp
AI
rise in the prevalence of autism deserves
machine
an
learning.
urgent response by the
Lordy.
scientific community. As Bobby said, the NIH has invested a lot of money to study autism over the years.
Oh,
but
brother.
the research has not produced the answers that families and parents of autistic children deserve, and autistic children themselves deserve. For too long, it's been taboo to ask some questions for fear that scientific work might reveal a politically incorrect answer.
Oh my
Because
God.
of this restricted
Woke.
focus in scientific investigations, the answers
we're
for families have been
eradicating
similarly
woke
restricted,
from autism
often pointing families
research.
to behavioral therapies that don't work for every kid, or suggest non-modifiable genetic factors as the cause. But genetics alone can't explain such a sharp rise in autism prevalence over just a few decades, as the president said. In coming months and years, as NIH scientists learn more that can help autistic children and their families, we won't delay. Like scientists often like to do, I can say as a scientist myself, it's really tempting to delay, but but in face of a problem like this, you have to move fast. But we will not delay before telling American people about what we find, and we will win the public trust with transparency and rigor. Already, our broadened focus on autism research has pointed to 2 items that will help families prevent and treat some cases of autism. I'll leave the good news on these 2 items to my close friends and colleagues, Dr. McCary and Dr. Oz. We've been working together closely on this problem for the past 6 months, and our cooperation represents an unprecedented collaboration with Secretary Kennedy's Department of Health and Human Services and with President Trump. I'm delighted to introduce Dr. Marty McCary, Commissioner of the Food and Drug Administration, who will tell you about these announcements of practical help for families with autism.
Great, thank you, Dr. Bhattacharya. Mr. President, this is the start of a historic shift in medical culture. This administration is working together to ask big questions about why our nation's children are getting sick.
He ain't wrong.
So fast.
It is. It's just not in a good
Medicine
direction.
is doing small little studies, giving us answers we already knew. But we've got to make a difference. You've given us a charge to identify root causes, and we are not going to stop so that we can end the suffering we are watching. And if you've seen a kid with autism, with severe autism, it's hard to watch. Kids get frustrated, they get angry, they can be crying because they want to speak and they can't speak. It's hard to watch, and it may be entirely preventable. For an epidemiologist, that child is an expanding statistic. But for a child, it can
Also
be
need to
brutal
understand something
to
here.
have
Not
autism.
only is this like
Today, the
not
FDA
a
is taking
curable
action
disease,
to update the
but it's
label on
also
acetaminophen
not like
and sending a letter
a
to all US
severe
doctors letting them
setback.
know about the
So the
risks
way
in
that they're
pregnancy.
presenting this
We now have data
as
we
a
cannot ignore.
like as
a
a
very large
curable
study, the
disease
Boston birth
is only
cohort,
going to stigmatize
Researchers
people with
that have,
autism
from
further.
Johns Hopkins, my former
It's
Boston
nutty.
University found,
This is
quote,
just
unquote,
like it's just
consistent
eugenics. It
associations
seems like.
between acetaminophen in pregnancy and autism. And the Nurses' Health Study with researchers from Yale, Columbia, and Harvard looking at 9,000 kids found that acetaminophen use in pregnancy was associated with neurodevelopmental disorders.
What if they
And
find
4
autism
weeks
to be
ago,
inherited?
a
I
Mount
mean, it
Sinai
is.
Harvard
It
study
is.
reviewed all
It is
the
inherited.
existing
Will they
literature
start a
and
sterilization
found the
campaign?
overwhelming body of evidence points
Hope
to an
not.
Sure, you'll be able to find a study to the contrary. That's how science works. But to quote the dean of the Harvard School of Public Health, there is a causal relationship between prenatal acetaminophen use and neurodevelopmental disorders of ADHD and autism spectrum disorder. We cannot wait any longer. And honestly, there's been this perfunctory, reactionary, mindless practice in medicine. I learned it in medical school and residency. Just treat all fevers, low-grade fevers, treat them with acetaminophen. Why? What are we doing? A study out of Hopkins actually showed that treating a fever can prolong the duration of illness in a young kid. Maybe that's because a fever is a body's natural way of ridding an infection.
Wait.
When my wife was pregnant
this guy's
and
a
delivered our son
doctor.
a few months
Ain't
ago,
no way.
How?
How is that possible?
She said no, and then they looked to me and I said, absolutely no. I'm also here to announce good news. Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells. It's a fairly established, mature pathway.
Bro, some fevers, if left unaddressed with medical intervention, can cause permanent brain damage and even kill people. What are we talking about, dude?
Folate deficiency.
What are you talking
Two-thirds
about?
of kids with autism symptoms had improvement, and some marked improvement. Mr. President, you told us to do what's medically right, to go bold, and not worry about the corporations and the lobbyists. So that's what we're here doing today. Thank you, Mr. President.
Thank you.
Thanks, Marty. I think you all appreciate the passion in the President's voice. We've been hearing that since the inauguration. In fact, even before the inauguration, the President was upset about what he spoke to today. And so together with Secretary Kennedy, who's made it his life's work to address some of these challenges with autism, they challenged us. In fact, they were harsher than that. They wanted no silos to break down what the NIH would do, what the FDA would do, what CMS would do. They insisted that the physician leaders bust through the clutter because their agencies had the power if we didn't do what every other prior administration had done, which is to let people function within their siloed environments. Because of that, in historic fashion and a very accelerated manner, we have a response today to the autism crisis. It is the first of several chapters, but this is breaking news. You've heard some of it. The response to the autism crisis is going to continue to come to you.
I can't believe how many people are television guys, by the way. Dr. Ross, even RFK Jr. Like, this is the podcast, their television administration
is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be two questions that you have, two questions that should come to your mind. The first is, how will patients and parents get access to the treatment? I'll tell you how. Over half of American children are covered by Medicaid and CHIP, government health insurance, over half.
Well,
therefore, because they're covered
too
in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons, because we want the right kids getting the right prescription medications. We believe private insurance companies will rapidly follow our lead if they have not already done so. And again, to make sure that this is safe and effective treatment, you need a physician to prescribe the medication because it's on prescription. Second big question. How are we going to collect clinical data to answer the big questions that the President's asking and the Secretary insists that we offer? CMS is also issuing guidance to convene states and existing research networks to support NIH and FDA in their research efforts of prescription leucovorin, while also maintaining the privacy of all patients, all health information of our beneficiaries. Collecting real-world data, which is what many of you have been asking us to do in the community, is fast. It is life-saving, and we'll get answers based on what happens over the next few months with this approach. The aggressive approach, and it is aggressive, demanded by the President and by the Secretary, have already identified risk factors and opened the door for the first FDA-recognized treatment pathway for autism. It is the first of its kind, and it wouldn't have happened without the leadership of the President and the Secretary. The five-fold increased prevalence of autism over the past 25 years demands a rapid response.
Face of autism, simply
the average
terrifying.
Clinician, researcher, we spoke to many, thought it would take 5 years to get this data. Parents are unwilling to wait 5 years. The President is unwilling to wait 5 years for these results. So the President and the Secretary are acting today with this tri-agency move. The administration's bold actions investing in groundbreaking research follow the science. They restore trust, which has been lacking, and they will change the trajectory for millions of American families. Mr. President, God bless you for being brave.
Thank you very much.
So let me introduce Dr. Fink, who's acting administrator. And after Dr. Fink, we've got some wonderful women, Jackie and Amanda. If, I know it's going to be tough, but if you can make some comments about this historic
they're talking
day.
about autism like it's like AIDS. They're talking about autism like it's just like if you have the tism, you're cooked.
As a pediatrician and
And
mom,
not just like have, you know, varying degrees of hyperfixations on trains and shit. You know what I mean? Or you're like a numbers guy.
of what we are all concerned
Please stop.
about
Some
the
kids
rising
have it
rates
worse than
of
you know.
neuro
Shut the fuck up. I do know. That's why I said to varying degrees. It can be debilitating, but it's simply not a disease. Okay? Oh my God, chatter.
We are also sharing this information with our nation's doctors. And we encourage you, as always, to consult with your doctor to make the best decision for you. All too often, it's easy to think that medicines we buy without a prescription pose little to no risk for the mom or the baby. As you heard today, pregnant women who need high fever or pain reduction during pregnancy should take the lowest effective dose of acetaminophen for the shortest possible duration. Most women will not meet these indications
Yelling at us on
during
won't
their
help when you have the
pregnancies.
president and staff up there straight up lying about it.
I am encouraged by these developments today.
The administration is
because
like
it
one
another-
step removed from putting all autistic people that they've branded as autistic into where they sterilize them by force. And there are parents in here with autistic children yelling at me because I didn't like sufficiently talk about some of the worst aspects of this spectrum. Okay.
Thank you. Thank you, Mr. President and team, for all your work. This is an historic day, and I'm thankful to be here. I have a son who's 5 who is profoundly autistic, and you've probably heard if you've met one autistic child, you've met one autistic child. It's a spectrum, which I don't think the spectrum is helpful, but that's another conversation. He is an amazing little boy.
She's just
blessing.
dunking on her kid, bro.
God.
I got a 5-year-old with the full-blown tism.
He's marvelous. He can count to 1,000. He knows all of his letters and the sounds they make and a word for each one. But he also has a lot of obstacles. He is nonverbal. He can say those numbers and letters, but there's no communication. Unless you've lived with profound autism, you have no idea. You have no idea. He, like you said, he will get frustrated because he can't speak. It's not even that he can't speak. Sometimes he just doesn't understand what I'm saying. He understands the word no, but he doesn't understand the why behind the no. And that's a huge part of discipline. That's the discipline. So it's very hard to discipline a child with autism so you have these behaviors. And it's a very hopeless feeling. It's very isolating being a parent with a profound autistic child. Even just taking them over to your friend's house is something we just don't do because, again, they're going to be met with no, 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 and no understanding of why. And then there's a meltdown. And then you're in a situation where you're just helpless and you're just trying to protect your kid. So it's just better not to do it. You learn your limits, and it's been really hard. This is amazing that we're here today. And no one has been able to point to anything to say this is what caused it. And you can't point to that and say it didn't cause it. I have no idea. I am completely open. I'm not blaming anything, but I'm open to the discussion and the fact that there's work being done to find answers. I'm very grateful. I was already excited to vote for Mr. Trump anyway, Mr. President. But when we got word of RFK doing his work, I was ecstatic. I could not wait for this work to be done, that somebody would try to find us some answers. I'm just very grateful. I pray for my son every day.
According to Trump, it's because you ate Tylenol when you were pregnant. How does that work? Yeah, you did this seemingly horrible thing to your child because you presented as this horrible disease that you've inflicted upon your child.
So extremely grateful for the opportunity to be here and share my son's story. My son is Eddie. He's 11. He's on the opposite end of the spectrum from what Amanda just explained. He's considered high functioning. He was not always high functioning. He was nonverbal till the age 4. We've had quite a hard time to get to the place where we are today. I am just so grateful to President Trump and the entire administration for finally listening to
high functioning, low
moms
functioning is the
who have been
older
crying out for help
terminology that
for
used to be
answers for
used. I
years.
think they
I've
changed
met
it. There's
so
always
many other
patches on
moms
this
with
stuff,
children on the
but
spectrum in the 9
but it
years
just
since
means
my
that like
son's
high functioning just means
diagnosis.
that you don't need like a
And
lot of
they all have
assistance
very
in terms of
similar
like
stories, and
socializing.
they've all
You don't have like
just wanted
significant
somebody to
medical,
listen,
significant
to
dietary
not
restrictions,
ridicule
things of that
them
nature.
Or look at them like they were the crazy people. It's hard when you don't have doctors that take the
I
time
think
to
the
really
new meta
listen
is to
and
say
find
like
out when the
support
change happened
needs
and
or
what change
something,
happened.
right?
And it's just
Back in my
I've been
day, it
praying
was
for
high
this
functioning,
day
low
for 9
functioning.
years, and I'm so thankful to God for bringing the administration into our lives. And I'm speechless. This day is a day I never thought would happen. I thought that we would never have an administration that was courageous enough to look into things that no prior administration had. So I'm just here to express my gratitude, and I am
It's
looking forward to what
full-blown
comes
read a health
from this,
journal.
and hopefully
Yeah,
we just get more
full-blown
answers.
autism.
So thank you.
Thank you very much.
Full-blown autism.
So I just want to say acetaminophen is basically Tylenol, essentially, because I noticed that term is used throughout this conference. So it's essentially Tylenol. And I just recommend strongly.
What's the smoke that these motherfuckers have for Johnson & Johnson, dude? They are just like, seems like they're just singling Johnson & Johnson out.
Would perhaps be forced to use it. And that would mean you just can't tough it out. No matter what you do, you can't tough it out. So that's up to you and your doctor. But there's a very strong recommendation, maybe stronger from me than from the group, because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it.
There's
You
other
just
acetaminophen
can't-
generics out there.
Fight like hell not to take
Like,
it.
I have it right
There
here.
may be a point where you have to, and that you'll. And it's so important to me to see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby, even if it's
Delicate
2
little
years,
body
3
of
years,
a
4
baby.
years. You just break it up into, I would say 5.
I'm doing
but
it.
Let's say 4
I'm
visits
doing
to the
it.
doctor instead of 1. And certain
my
things
neck
I think
pain.
you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants that pumped into a body? And there were rumors about both of them for a long time. But we're having them taken out. We're having them taken out of the vaccines.
And guess what?
Hepatitis B, again.
I'm pregnant. I'm pregante. I'm mpreg. And I just took some acetaminophen, dude. God damn. You already know. I'm trying to make sure my next of kin, this baby that's coming out of my butt, is going to be the most
Common
autistic.
sense. And they have that too.
Mega autism.
They have that too, a lot. But I recommend the hepatitis B. Take it at 12. Sexually transmitted. You don't have to give it to the baby when the baby's 2 years old. And there are a lot of theories on that, but not when they're 12. Doesn't seem to be a problem at all. The MMR and the chickenpox. Chickenpox has already been broken out. It's a singular shot, but the MMR is not. And I've heard for years that there's a problem with it, but they say that there's no problem if you do each shot separately, not put together. So an MMR, go out and do it separately. Don't take Tylenol. Don't give Tylenol to the baby after the baby's born. Every time the baby gets a shot, the baby gets a shot. They say, here, take a cup of Tylenol. I've heard that for years. Take Tylenol. Don't take Tylenol. Don't have your baby take Tylenol. Now, Tylenol is fine for people that
Don't
aren't
do it, baby.
pregnant.
Don't
that
do it,
aren't,
baby.
in a
Tough it out,
situation
baby.
We're talking about one very specific situation. If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary. Don't
What
do
is
it.
this?
Break
Was that
up your
even a
visits
part?
to the doctors.
Was
Break
that
them
even a
up.
part
Do
of
it
what the
in 5
doctors
if
were
you
saying?
can.
I mean,
it's-
I made the
you're
mistake
gonna have
of
to go
claiming the
back 'cause I think
doctors
you're
are
late.
saying
You're gonna
this.
go back each year for 4 years, 5 years, 3 years. Just break it up. break it up, because it's too much liquid. Too many different things are going into that baby at too big a number.
Too many liquids are going
the
into
size
the
of
baby.
this thing, when you look at it,
He's
different
freestyling.
vaccines and beyond vaccines, and 80.
Too many liquids
Then
to
you give
the
that to a little
baby.
kid. I mean, I can tell you that I had a woman who worked for me, a beautiful, wonderful woman, worked in Trump Tower, and she had the most perfect child, beautiful, just perfect.
But then the baby
And I
was
remember
hit
this
with
little
a
blonde-haired
full-blown
boy running around the
autism.
lobby, crying her eyes
He
out
keeps
behind the
talking
counter.
about trains and planes.
She worked at the front desk. She was crying her eyes out. I've never, as much as I've ever seen anyone distraught, she was. I said, "Are you okay? What happened?" My boy, I've lost my boy." "What does that mean, your boy?" "My boy, you know him, sir. You've seen him grow up. He was so beautiful. And I took him for a vaccine, sir. And he developed this unbelievable, I think she said 107, 108. You know, it goes well beyond when this happens. It goes up to 106, 107, 108. You know, we hear 105 and you're in trouble, but it just goes up to a level that you never hear about, but it goes up very high. And it's fried. They get fried. She said, I took him, he developed an unbelievable temperature. And I've lost him, sir. He's gone. And then I saw the boy. It was so tragic to see. That was the following day. After the vaccine. And I've seen it 2 other times, and I think 3 other times, but 2 other times, where they go to the doctor and they get the vaccine, they get the shot. The kid is, badly hurt. Let's be nice, badly hurt. And just do it. Break it up into 5. Break it up into 4. Break it up into 3 if you have to.
What
but
is
go to
this
the
guy
doctor 4
saying?
times
Like,
instead
this
of
is
once,
literally
or 5 times
the president
instead of once.
making.
And for some reason, they insist that you put it all into the body.
Giving
and maybe
medical
that's the drug
advice.
companies that make more money that way,
As opposed to
maybe
the
it's
doctors.
because they don't want to be, doing this
And
so
he's just
much.
talking
Maybe
out
it
of his
was-
ass.
maybe
He's
it's the doctors. They
freestyling.
get maybe more money. Who the hell knows what it is? Don't do it. Get them broken into 4 or 5 visits. Do it 4 or 5. That means you have 20%, 25% what you're putting into the baby's body. It can only help. And the other things I told you about, just the word tough it out. It's easy for me to say tough it out, but sometimes in life, with a lot of other things, you have to tough it out also. Don't take Tylenol. Don't give Tylenol to the baby. When the baby's born, they throw it at you. Here, give them a couple of Tylenol. They give them a shot. They give them a vaccine. And every time they give them a vaccine, they're throwing Tylenol. And some of these babies, they're long born, and all of a sudden they're gone. And it doesn't hurt not to do it. It doesn't hurt. There's no downside. There's no downside at all. And break up MMR. Break it up. It's practically a known fact that if you break it up, you're not going to have a problem. But for years, we've been hearing how bad MMR is as a combination.
No,
and I'm
we
very
haven't.
happy that you broke out chickenpox because that was
we
really
haven't.
a problem.
No, that's not
And there
a
are
thing
other
that we've
things.
been
It's interesting
hearing.
because there are other things.
Hear other things.
We're talking about other different drugs, pills that you take that we know are so bad, and they don't take them
my
anymore. But for some
God.
reason, with this, they keep taking it. Don't take Tylenol.
Trump used
There's
platform
no
or presidency to
downside.
promote unproven
Don't
testing
take it.
Tylenol vaccines to autism without new
You'll be
evidence.
uncomfortable. It won't be as easy, maybe. But don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born. And you know what? We have more than 3 years left. And I told Bobby and the doctors behind me, and they are so committed to this, I told them that this is the number one thing I want to do from you. And, we have something else called Favored Nations, where I'm going to be reducing drug prices by 1,000%, by 900, 600, 500, 1,200. We're going to be reducing drug prices at levels never seen. It's called Favored Nations. We're going to be paying what right now, we're like the garbage can for the rest of the world, and we have been for forever. We pay much higher for drugs than the rest of the world. We subsidize the rest of the world. We're not doing that anymore. And that's a big thing. That's a big thing. That's bigger than anything. I told the story the other night that I was so proud in my first term that for the final year, drug prices went down 0.25%. And I was so proud. I said, why? I'm the first one to do it. I think it was 28 years, they said, where drug prices went down from the beginning of the term to the end. And I was so proud. I called a news conference. I said, you know, drug prices have gone down. First time it's happened in 28 years. You know what it was? 0.25%. I was so proud. Now we're going to have them go down from $100 a pill to $9 a pill. From $1,300 for a shot of like an Ozempic or I call it the fat pill or the fat drug. Sometimes it works, I guess, for people. The ones I've seen, it hasn't worked so well. I got a lot of friends, they're fat. They said, yeah, I lost some weight. I said, you don't look it to me.
Oh,
but
my
they pay
God.
$1,300, $1,200, and they go to London and they pay $88. And they call me, they go, what's this all about? We're subsidizing the rest of the world stupidly because we have a lot of stupid people in this country running things.
Okay.
And how
He's
big
never
is that?
coming
But
after
to me,
Zim
that's
'cause he
nothing compared
consumes
to autism. I see that gorgeous boy. I have a big present for him in the back. You know, you bring him back. We're going to bring him into the Oval Office. I have the best present he's ever going to get, okay? A big one. I saved it for you, okay? Because I heard you were coming. Look how beautiful he is. So that's it. There's nothing much to say. Don't take Tylenol if you're pregnant, and don't give Tylenol to your child when he's born or she's born. Don't give it. Just don't give it. And we're going to have, I think, really, if you do all the things that I say, break it up, just break it up, break up the shots with the doctor. MMRs, as I told you, separate. Chickenpox already separate. You do these things. I'm telling you, I want to, when I leave office, I don't want to have, it's going to be the kind of number that we're hearing where it's 1 in 32 or 1 in 10, because I've heard 1 in 10 also. And in California, it's really bad. I want it to be, let's get it back to maybe 1 in 10,000 or 1 in 20,000 or maybe none in 20,000. And the only way you're going to do that, because this is artificially induced. This is induced by something. You don't go from 1 in 20,000 to 1 in 10,000, then to 1 in 10. That means you're taking something and something's wrong. And I feel very certain, and I know I'll be criticized. Someday they'll look back and they'll say, well, it wasn't, but I think it will. I think we're going to have a tremendous, this is the most important thing. There's nothing more important than me. We cured inflation that Biden gave us. He gave us so much inflation, the biggest ever in history. We got inflation done. We brought prices down. We gave you the largest tax cuts, all that stuff. It doesn't mean a thing compared to what we're doing today. This means everything. So we're going to save a lot of children from a tough life, really tough life. We're going to save a lot of parents from a tough life. Okay, how about a few questions? Let's just make it on this subject. This is so beyond as a subject that I'd rather not talk about, some nonsense on the economy.
This is so important.
And I
Don't
will
make
say
me
this,
ramble. I
the
will
economy
ramble.
is unbelievable. The stock market just hit another record high and all that stuff. This means more to me. Yeah, please.
Mr. President, I have one on your announcement, one on vaccines that's also related.
Yes.
Why do you think we haven't heard more previously about the tie to
Woke.
autism and acetaminophen?
Nobody
woke.
knows. I don't know. Not only that, when you say it, you get attacked. I was saying something similar, not as strongly, because now facts are on our side. But I was saying it with Bobby 20 years ago, and I was attacked. I said, whoa, what was that all about?
Trump has always been a vaccine skeptic and talked about how too many vaccines is what causes autism. He used to say that all the time.
Drug companies, doctors, I don't know what it is. All I want to do, I don't care. I don't care about being attacked. It doesn't matter to me. I believe that the numbers at the end of our term or shortly thereafter could be really phenomenal. I want it to go up just like it came down to this horrible level. 1 in 10, 1 in 12. I was told 1 in 10. I was told 1 in 12. Today I heard 1 in 31 if you add the girls and the boys together. It's crazy. And it was 1 in 10,000 and 1 in 20,000. It's not even sustainable for a country. You want to know the truth. And there are other places that don't have it.
That's not true.
And they have things in common.
That's not true.
And that's called medical
That's literally
research,
not
please.
true. If there are no autism diagnoses taking place, that is a matter of diagnostics, not a matter of there's no autism in those countries. And considering that this is seen as a spectrum in terms of like the social component, okay, many people that have it, including like older generations of people that have it, might not even know that they have it. They're just, back in the day, look, this is broad. This is very broad, right? Back in the day, when someone was autistic, they would just go, that guy likes math. That guy's a little weird. It is what it is, okay? That's it. That's how they used to do it back then. Now, obviously, that wasn't great either, okay? But that was it. They would just be like, oh, he's eccentric, you know? Yeah, your grandmother that collects spoons, just a little eccentric. Your uncle that loves model trains, just a little eccentric. That's it. The idea that this is like not seen elsewhere is just a matter of diagnostics. And considering that this is not like a disease or anything, like it's just more so a matter of normalizing. It's just more so a matter of normalizing the way that the way that people deal with autism that they have, and also other people that have a better way of socializing with people who have autism.
How do you clear up this confusion?
That's the establishment. They're funded by lots of different groups. And you know what? Maybe they're right. I don't think they are, because I don't think the facts bear it out at all. They're fighting for something that, in my opinion, they shouldn't be fighting for. But here's the thing. There's no downside to doing, other than a mother will have to, as I say, tough it out a little bit. There's no downside to doing this. It's not like, oh, if you do this, you're going
there's
to
no
die.
downsides
There's no
to
downside.
the unlimited
There's no
amount
downside to
of
going over a 4-year or 5-year period or a
unsubstantiated
3-year period.
medical
Or even if you
skepticism
space
that
them
we
out for
just
6
presented.
months.
And also the
space
fact
them out.
that
There's no downside.
I even doubled down on another unsubstantiated, totally ridiculous statement about vaccines. No downsides whatsoever to vaccine skepticism, except for previously combated diseases coming back because people are just not going to get vaccinated for it.
And there's no
Oh my
downside
Lord.
to doing it. Everything I said, there's no downside to doing it. It can only be good. And I think you're going to see very good results. That's establishment stuff. And we've been reading that about a lot of things for years. And you know what's happened? We've gone from 1 in 20,000 to 1 in 10,000 to 1 in 32 to 1 in 10. Think of it. 1 in 10 or 12 or 1 in 31. Think of it. 1 in 31 people, young kids, get autism? What is it, Jeff?
My question is about leucovorin. You mentioned that as part of your plan. That is also a chemotherapy treatment. Have you been in touch with the drug companies to increase production about that? And just, I'm going to throw in my follow-up at the same time. Dr. Oz mentioned that this will be available with CHIP, children who are on CHIP. But the big beautiful bill reduced funding for CHIP and Medicaid by $1 trillion over the next 10 years. Are you concerned that that will impact your ability to get this drug out?
I'll explain it to you in a second, but please go ahead.
Thank you.
Thank you. Leucovorin is not a chemotherapy, but it is a vitamin given with chemotherapy sometimes. And the idea here is that the folic acid receptor in the brain is blocked by some antibody response. It might be 20, 40, 50% of kids with autism. And leucovorin will bypass that blocked receptor. And that's why so many doctors are probably seeing so much clinical improvement on kids with leucovorin.
Production.
Yeah, we've been in touch with the companies, and they are prepared to ramp up production, and we actually talked to them about a month ago.
And on your second part of your nasty question, the number is that the great big beautiful bill, which is the greatest, I think one of the best things ever passed in the history, with the tax cuts and regulation cuts and all of the things it does, no tax on tips, no tax on Social Security, no tax on overtime, all of it does. It also gives $200 million, as just explained by Dr. Oz. And I'd like you to explain that, Doctor, to exactly what you're saying.
The Big Beautiful Bill actually increases Medicaid spending projected over the next 10 years by $200 billion. There's also a $50 billion rural health transformation fund, which will allow a lot of these programs to get in the rural parts of the country that the president and Congress are handing to governors to start distributing. Those grants have already gone out. The money will be allocated by the end of this calendar year. And I want to point out that the ability of NIH to do research that feeds and hands the ball to the FDA, which then can change labeling to allow Medicaid programs in states to fund this program, will ensure that the things that President Trump and Secretary Kennedy desire are financially affordable for the families around America.
You mentioned CHIP, sir. That's why I asked that question. You mentioned that CHIP would fund this for children.
Well, most of the kids are on Medicaid, probably 43% on Medicaid, another 8-10% on CHIP, and all the programs in general are being evaluated. Most of what the One Big Beautiful Bill was seeking to do was to remove fraud, waste, and abuse. But the programs themselves should stay financially intact for the people for whom they were designed, and in this case, for children.
And the only thing we cut, so that's $200 billion positive. The only thing we cut was for fraud, waste, and abuse, of which there was a lot in this country, and nobody minds that. Yeah, please.
Mr. President, you said that there is no reason to give newborn babies hepatitis B vaccines. But hepatitis B can be contracted not just through sexually transmitted diseases. It can come from needles to open wounds. So when you say you feel, is that appropriate to be telling?
I think it's absolutely appropriate. I think they should wait till they're 12 years old. Yes, please.
Mr. President, thank you all for being here. You've been talking about reducing autism by spacing out vaccines. Would you like other combined vaccines babies receive to be spaced out, like MMRV?
What is this again?
You've been talking.
What is speak up, please?
Sir. You've been talking about reducing autism by spacing out vaccines.
Right, correct.
Would you like the other combined vaccines babies receive to be spaced out, like MMRV?
I would say yes, but that just is, for me, it's a lot of common sense involved in this. It's a process, but we're looking, but it should at least be given separately. Now, it's possible that you can reduce them and I'd give them in small doses, but it's possible maybe in that particular case, the MMR wouldn't work in small doses, but you can certainly give them as separate shots. It's been proven to be very safe when you give them in separate shots instead of mixing. So I don't think there's any reason to do that. Do you agree with it? I'm not a doctor, but I'm giving my opinion. I don't think there's any reason to do that. So it's been proven to be safe when you break them up. But MMR by itself, I've heard bad things about it for many years. Yes, please.
That's a great way to end that conversation. I'm not a doctor. Why am I giving my opinion? A question we are all asking.
With a population of children who might have social boundary difficulties, and then you have children who are, going to grow up to be adults in diapers. I mean, what do you think?
We don't know how broad the spectrum is. We don't know exactly where it starts and where it ends, but we do know what we're going through. We're going through some very serious trouble, and we know autism. I mean, it could be bigger, it could be small, a little bit smaller. But the number is unacceptable. And the number, the way it's come down, because the spectrums remain the same, the number, the way it's come down is just unacceptable, meaning come down to that level of 1 in 10, 1 in 12, 1 in 31.
Mr. President, medical professionals.
Go ahead in the back.
Mr. President, this question is more directed towards Secretary Kennedy. It was talked about that we're just kind of finding out about the fact that babies are affected this way. Is there a concern that information is being suppressed right now within HHS, and could an investigation perhaps be launched seeing any more information?
Well, I think information has been really not given out very freely over the years, absolutely. And I think that's by drug companies and maybe doctors, but I certainly think that over the years. I think this is a different group. We have a lot of information. And that information, I mean, it's the information that we have that we're making these statements. And I'm making them out front, and I'm making them loud, and I'm making them strongly not to take Tylenol, not to take it. Just don't take it unless it's absolutely necessary, and there's not too many cases where that will be the case. And again, what's the worst? The worst is nothing can happen. It's very positive. That's a positive thing. But I don't believe I don't actually believe that's possible. I think the results are going to be amazing. I want to see amazing results by the time I leave this beautiful building. And I will consider this I believe, with the wars, I've stopped 7 different wars. I've saved millions of lives. I've done a lot of things.
Oh,
This will be
I thought
as
we weren't
important as
talking about
any
other
single
shit.
thing, because
Turns
I
out we
know
are.
ladies, beautiful ladies just like this that are going through the same thing, and it's not easy, and I admire you for being able to do it. But I admire him too. I wish I had a face that looked like that. If I
Do they
looked like
just
him, I
want
would
a
have been
mountain
president
of
a long time
litigation?
ago.
Is that what it is? Like, what were they thinking with this?
Is widely used in other countries too. As you make this announcement, do you expect your decision may affect
I hope
other
they
countries?
follow it. Yeah, I hope they follow it. Yeah, other countries are, sell Tylenol. Some countries don't. I mean, I hear Cuba now. Again, you'll have to check this out. But I hear Cuba doesn't have it because it's very expensive, and they don't have the money to have it, or they don't want to spend the money to have it. They don't have Tylenol, and I hear they have essentially no autism. So you have to check it out. Yeah, Brian.
Medical professionals have warned
No,
for decades.
I said, no, not you. You're CNN. You're fake news. Go ahead, Brian.
Thank you, Mr. President. I want to go back to the Amish community, if I can, just for a second. I recently saw a man from Minnesota, an Amish man from Minnesota, on a podcast, and the host asked him what the rates were for like ADHD and autism, and he had no idea about ADHD.
Oh my God, Theo
Didn't know
Vaughn.
that existed.
Oh
He
my
certainly
God.
didn't
Oh
know
my
who
God. It's
faces-
because of Theo Vaughn. Oh my God. Theo Vaughn is literally.
With the
Oh
Amish
no.
community. And they don't take all of this junk.
Dude,
It
they don't
doesn't
go to the doctor. That doesn't mean that they don't have autism. What the going on, bro? Oh my God. Yeah, if they don't go to the doctor, then they don't know if they have autism or ADHD. It's that
Vaccines
simple.
and
What the?
not. And we know
It's like literally before the first autism diagnosis, nobody had autism. Okay? Yeah, I guess nobody. No, it doesn't mean that nobody had autism. It just means that nobody was diagnosed with autism.
Causes of autism.
I wish they would, yeah.
And why are they so closed-minded?
Well, they just.
Yeah, at a time when everyone was dying by the age of 10, okay? But when kids were just dropping before vaccines, when kids were dropping before the age of 10, nobody knew why they were dying, but they were dying for some reason. They were dying, but they were healthy. They didn't have autism.
Some people think, mostly Republicans actually, I'll tell you, the Democrats think it was, they think Operation Warp Speed was one of the greatest things any president has done, any president. It's, we're very proud of what happened. We got hit with something that came from a place that shouldn't have happened, but it did happen. Those things take place, and you're very unpleasantly surprised. But no, I'm a big believer in vaccines, the polio vaccine, big believer in vaccines. I know Bobby and you guys have it out a little bit, but he's a believer in vaccines too. But I've seen how great vaccines can be, how incredible they can be. So I'm a believer. Yeah.
Sir.
Yeah, please.
Your comments made about MMR and hepatitis B, I know you
Right.
said those were your suggestions, but have you spoken with Secretary Kennedy about actually making those changes?
I have, yeah, I have. I've spoken to all the doctors about it, and doctors that are not here right now. I've spoken to many doctors about everything we're talking about. And the Tylenol has started to be spoken of over the last period of time, but we've been doing the research. A lot of what they've been speaking about comes from right here, by research done by these people. And I just say it again, don't take Tylenol. Don't take it. And don't give it to your child after your child is born. And do all those other things, little things, just spread out your visits, et cetera, on the vaccine. And I want to thank everybody. This is a very important day. Thank you very much.
Will you meet with the Democratic leaders, sir?
Oh my God, bro. I mean, let's be real. This was like, what was the alternative? What's the alternative? Of course this was going to happen. Of course this was going to happen. And this is just the beginning too. It's going to get even worse than this. You let the madmen run the asylum, and this is what's going to happen. I guess, like, in some ways, I thought that while liberal capitalism is in decline, corporate interests would still offer some significant setbacks to this administration, accelerating the decline. Because, like, you just don't want, it's not good for even the capital owners if like people are this stupid, right? If they're anti-science, anti-medicine to this degree, it's still not good for the profit margins, right? But it turns out there's nothing people can do. These guys are just gonna do whatever the fuck they want. I cannot believe it. It feels so insane that this is the administration, this is the government, this is the president. These are the people running the FDA and the CDC and the HHS. This PhD organic chemistry guy says RFK Jr. is set to announce Tylenol causes autism, and then he'll push the cure. Leucovorin, folinic acid. Who sells folinic acid? Dr. Oz's supplement company, iHerb. Think about that. A government health official tied to the very supplement company that benefits from RFK Jr.'s bogus cure. This is in public health. It's corrupt. It's corruption dressed up as wellness. We're so cooked. We're so unimaginably cooked. Here's the most recent and largest study I could find. Folinic acid modestly reduced autism severity in a 2024 RCT with the biggest gains in kids with folate receptor autoantibodies. Safe, but the benefit, give or take 1 point on CARS, may be too small to be clinically meaningful. A 24-week double-blind trial tested high-dose folinic acid in 80 children with autism ages 2 to 10. Both placebo and treatment groups improved. A million studies that prove that Tylenol is the least consequential anti-inflammatory drug that pregnant parents can take doesn't mean anything. One study on the opposite side that says folinic acid could be helpful in reducing some of the aspects of autism, then, you know, all systems go. I don't know. I just don't know what to say. What do you say to this? What do you say to this? What do you say to any of this? What an insane situation we found ourselves in. I mean, it's expected, but it still feels crazy when you're watching it unfold, you know?